Good evening. My name is Miss Natasha Berridge, and I am one of the facial plastic surgeons here at the London Transgender Clinic. This evening, we've got a great live with one of our patients, Francesca Martin. So I'm just about to get her to join in. So please bear with me. So just waiting. Hello, good evening. Hi. So just waiting for Francesca to join us, I think.
Hello.
Hello. How are you? I
I'm
am
good, thanks. How are
well. Thank
you?
you so much for joining us this evening. Oh, it's a
Thanks
delight.
for
We've been
having
wanting to
me.
do this for a really, really long time. So really, really pleased that you're here to
Yeah,
join us. Shall I introduce you and then you can say a little bit about yourself?
yeah,
And hello,
absolutely.
everybody. Thank you for joining. So we've got the gorgeous, gorgeous Francesca Martin, and stunning. And it's fair to say, thank you very much.
Likewise.
It's fair to say that Francesca is a patient of ours at the London Transgender Clinic. And we thought that we would do this live. Francesca and I met last year at initial consultation. We'll talk a bit about that in a moment. But we thought it'd be a really, really useful thing to do the consult, to do a live where we spoke about the facial feminization process and just gave a very real and authentic approach from your account as to what facial feminization surgery was like for our followers, for those that are potentially interested in having FFS. So without further ado, do you want to tell us a bit about yourself, Francesca?
Um, yeah, I am Francesca. I'm trans. I'm based in London. I'm from Wales. I met Natasha last year, as she said, to have a consultation about FFS, and it was like clear to me initially that this was the right decision and the right place to go, just how she made me feel, and yeah, honestly, like
Oh, you know, we have this
amazing.
huge, huge, huge amount
Love
of love,
that.
respect. We're totally in awe of you at the clinic. So how do we do this? I mean, this is completely unscripted. As we mentioned, we wanted to be totally,
Hmm.
totally natural. Shall I just say, we had a few questions. What we did was we sent out a few questions to our
Yeah.
viewers actually, and just asked them what sort of questions they might want to be answered. So if I split them, maybe if I answer a question first and then I'll give you a question and we
Yeah.
do the live like that. And for those of you that
Sounds
are
good.
listening, if you have any questions that you want to be
Yeah.
answered, then if we can do that within the time frame, then we'd be more than delighted to do that. So firstly, I was asked what is FFS, and FFS stands for facial feminization surgery. And it really is a group of facial plastic surgical procedures that are used to treat gender dysphoria, gender incongruence, in the vast majority of time for trans females, but also for other gender diverse patients, so non-binary patients. But we also get cisgender patients that want to have facial feminization surgery, where their hope is to look a bit more feminine. Um, we don't prescribe a set standard of surgical procedures. It's very, very bespoke to the individual. But it includes a host of surgical procedures, which might range from brow bone contouring, brow lift, feminizing rhinoplasty, surgical upper lip lift, jawline contouring, chin contouring, and or thyroid shave. In addition to that, there is a slight crossover. So when you're altering the underlying facial skeleton, sometimes you may have excess soft tissue. So sometimes there's a bit of a line between feminization for the purposes of reducing and treating dysphoria and gender incongruence, but also, you know, we want to make sure that our patients maintain their facial features and look the best version of themselves, you know, the most authentic versions of themselves. So that might involve, you know, maybe a facelift, some submental liposuction, just so that the tissues on top sit nicely. So in a nutshell, that's facial feminization surgery. Is that fair to say, Francesca, that that was? Yeah,
Yeah, I would say so. You've
brilliant,
summed it
brilliant.
all up, baby.
We had a question for you. I mean, the next question actually that I was asked was, "What's the process before surgery?" So, Francesca, do you want to answer that? Because I think it might be quite nice for you.
Yeah, absolutely. So I approached the London Transgender Clinic. I was obviously looking about at multiple places. I approached them because it was kind of a no-brainer because I had a lot of friends that went there. So we had an initial consultation where I went in and basically expressed my concerns with my dysphoria and how I felt about my appearance. And I mean, there was a way longer list than what I ended up having because when we spoke about it with Natasha, I kind of realized that it was more like I went into it more thinking that I needed to like a host of things to like change everything opposed to maybe just having minor procedures to, I don't know, achieve the most harmonious kind of look. And I am really grateful for that. That we like actually, you actually kind of taught me off a ledge and were like, you don't need just X, Y, and Z because I think it's really easy to get carried away. So that's what the first consultation was like. The second, in between that, we went for X-rays to, I guess, see what we're working with. And I also had a lot of filler, which was disguising, I guess, the features that I was trying to get rid of. And so I had to have that dissolved before coming to actually have surgery. So there was a few appointments leading up to this, and then obviously the day came about.
So that's it really.
Yeah,
So
so
that's beautifully put, and I think a real honest answer of what the process was like for you, Francesca, as a patient. Yeah,
yeah, it was
yeah,
very
and hopefully
straightforward.
not intimidating at all. We're very much a family at
No, absolutely
LTC,
not.
and there are lots of people that you meet in that lead up to surgery. So, just for those that are joining now, Francesca made contact with LTC, and the first port of call is your first consultation. And the first consultation really is just meeting you as a person. We, as the surgeons, want to get to know about you. We want to know about your transition journey. We want to know about your support. We just
Hmm.
want to know about you. But it's really important as well that we find out what your goals are and what your expectations are of FFS. And our job actually is to guide you. So first and foremost is support and guide you, but also to let you know whether or not it's realistic, because we
Yeah.
have to be realistic. So Francesca said that, you know, she came with perhaps a list of things that she thought she needed, when pretty much we could have said, Francesca, what are you doing here? What are you?
Yeah.
But that aside, she was, you know, you came to see us because the goal was to treat your dysphoria. So it's very bespoke to the
Yeah.
individual, it's very bespoke to the patient that's sitting there. Part of that consultation process is to have an examination. You have some medical photographs taken for your medical records, and that also helps me and the other surgeon in the practice, who is the founder, Mr. Christopher Ingerfield. It allows us to do some virtual photographic simulation, which gives patients an idea, and it certainly gave you, Francesca, an idea of what the end result might be like after surgery. And it's a really good tool, because I think it allows you to ask us questions. We go over the risks that are associated with
Hmm.
surgery, because it is invasive surgery, and I think you'll talk about that a bit later on when you answer some more of the questions. And that's it. And then we allow patients, we allow Francesca to go off and have a think about what we discussed, and really just to take your time to decide if it was really what you wanted to do. Part of that process as well is going off and getting pre-surgical investigation. So that's really relevant to the technique or the procedure that you're having. And also just coming back to meet us and coming back to have a chat to us, and really just making a definitive plan as to what we're going to do for surgery. Francesca mentioned that she had a lot of facial filler, which was beautifully done by a group of
Yeah.
aesthetic doctors that I know within the profession, and they're fantastic. So a massive shout out to them. But really, if you're going to go through facial feminization surgery, the whole purpose of surgery is to maximize the surgical result. So you did have to dissolve some of that filler.
Yeah.
Do you want to tell them what was it like? Because one of the other things that needs to happen before surgery is that you have a very thorough and an in-depth pre-assessment appointment with our nurse. Did you have it with Roberto? Roberto's our lead nurse for pre-assessment.
I think I might have done it with
Okay,
my
okay.
gender clinic.
Where
Yeah, I believe that I did it with my gender clinic in Wales. And I actually, I can't, do you know what? It feels
oh,
like it was so long ago, I actually can't remember if we
yeah,
did a
no,
pre-assessment
you
or not. I'm
definitely
sure we
would have
probably
done,
did.
because this is where we assess our patient's fitness for a general anaesthetic. So just question. Yeah.
Oh, yeah, God, of course. I feel like
Oh,
I
don't
do
worry,
remember
but
this.
just
I
okay,
was
that's
tunnel
okay.
vision, you
But
know?
it's a process where patients are asked a lot of questions, and your fitness for a general anaesthetic is assessed. Um, so one of the questions, Francesca, another question was they wanted to know, did you, when you actually came to the day of surgery, how did you feel? And did you have much pain after the surgery? And if you want to, do you want to share what you had done potentially? It's entirely up.
Yeah, absolutely. Absolutely. So the day of the surgery, I obviously was filled with a lot of anxieties, also a lot of relief. I was like, wow, this is finally happening. I would say up until the day of the surgery, I didn't actually believe it was going to go ahead just because, I mean, it was obviously such a long thing in the making for me. I've thought about it for years, so it was just didn't feel like it was ever going to happen. So when the day came, I was really full of my anxieties, but also full of relief that, you know, I was finally here. And I came with
You
my
had a lot of friends,
friends
which is
and
amazing.
all was
So
well. Yeah, I had a lot
nice
of
that
friends.
support.
um, so sweet. I was really lucky. Um, and yeah, when I woke up, I was very happy, very giggly, very silly. There's lots of videos on my phone. Um, and I mean, I had some discomfort, but I think my major anxiety going into surgery was not really having the surgery, it was how am I going to cope afterwards. But obviously having the support system around you, which you touched on earlier, was really important because you asked about that throughout our consultations, and it was important that like you knew that I was going to be taken care of, you know. And I really was, and without that, I would have struggled definitely a lot more. But I think for me, there was discomfort, but I think it was more psychological recovering. I think it was the um, just I can't even put it into words. I just felt um, I just felt a lot. I think there was a lot of past trauma coming up, being trans, and you know these feelings of like dysphoria. I think they all kind of came to a head whilst I
Yeah.
was recovering. It was obviously good and bad because I mean
Yes.
surgery is only
Yeah.
half of the journey. You have to also do the internal work, and I feel like I did a lot of kind of going through that whilst I was recovering, which I'm really happy for. Well, not happy for,
Maybe not at
not at the
the time.
time, but I was grateful for because I had the support and the love from my friends and family. Um, and I mean, I just feel like ever since I've just been feeling better and better. As like it's been 3 months now, I think, and
Yeah.
I feel
I mean,
great.
Francesca,
I'm so happy,
well,
but it's
you're
also so
remarkable.
minor.
You're totally
It's
inspiring, and I
not,
have to say that it's such an honour to be able to be on not only your journey but the journey of our other patients as well. And it really is. I mean, I remember when you woke up from the operation. It gave us all a lot of
it's
giggles.
crazy.
You're amazing. So it's fair to say, though, isn't it, that when, and we always, we're not shy about this. We're very real about what the process involves and what potentially you're going to feel like after surgery. And a lot of people, particularly those that
Yeah,
undergo upper face work, uh, that have brow bone reconstruction,
Yes.
perhaps a rhinoplasty, it feels like you've been in around. It's heavy with
It was
Mike
heavy. It was
Tyson,
so
and then you
much.
wake up with a drain. You wake up with a big head bandage on. We obviously patients because we want everything
Yeah.
to adapt and the soft tissues to adapt to the new bony position. And you're in recovery for a good part of the day. Were you surprised when we told you that it was a day case procedure? Because I think a lot of patients are quite surprised when we tell them that, yeah. How did that make you
Yeah.
feel? Yeah,
I was definitely very surprised, especially waking up. I was like, wow, like I
yeah,
feel nuts. I have a drain in my head. You know, I was like, I think that alone, I was like, put me back to sleep. Um, but to be honest, I feel like the first couple of days were
okay,
probably the easiest part of surgery.
yeah,
I think you're still in a bit of a daze. Um, it, it was, I think it was maybe like day 4 that it finally, I was like, okay,
yeah,
I can feel this. Um, but yeah, I mean, I was surprised it was a day case. I mean, I was not mad because I got to go
absolutely.
home and sleep in my own bed, which is perfect. Um, but yeah, I had rhinoplasty, but I just had the tip done, and brow
Yeah,
contouring and hairline lowering with, I guess we did like an
yeah, yeah.
inverted
So
eyebrow lift, right, with that.
yeah, no,
So
I mean,
also
amazing. Your
snatched.
specific desires were, I mean, your dysphoria was mainly in the upper part of the face. Um,
Yeah,
there's no,
I just felt
yeah,
like very
yeah,
heavy
which
here, like Neanderthal.
you know how I feel, but I yeah, absolutely. I
Where is
mean,
it
you're
now?
you're absolutely beautiful on the inside and out, Francesca, and that's truly your strength and your beauty really radiates. But I know it wasn't an easy journey for you, and I think that's the thing that we like to impress upon our patients is that surgery isn't to be taken lightly, and patients react in different ways. But I think the
Yeah,
majority probably respond in the way that you do, which is you really there's a high, there's the excitement and the relief that you've gone through with surgery, and then the realization, which quite difficult actually. So
yeah.
support is immense. How long did you take off work? Because someone's asked how long realistically do they need to take off work?
So I'm self-employed. However, I would say if I were to go into an office, I would say I feel like I healed very fast. I think I came in 10 days after, and I don't know, I can't remember if I saw you or I saw the nurses, but everyone was so surprised at how, I guess, back to normal I was. So I would say like 10 days. Like after 10 days, I can't lie, I did go out
Did you
that
really?
evening. I had my stitches out, which was probably a bit
Francesca.
crazy. I did. It was my
Okay.
friend's birthday. But yeah, I would say 10 days. Honestly, I think it was a very fast recovery. Um, I think it was, I think the longest part for me, the heaviest part for me of
Yeah.
surgery was actually the rhinoplasty. Surprisingly, my forehead, I feel like it just healed like so fast and I
Yeah.
hardly bruised.
I have to
It was kind of back
say that as
to
well. I
normal.
think from a surgeon's perspective, and when I see patients in clinic after having FFS, particularly brow bone reconstruction, it is remarkable because it's a really big area that is dissected. The incisions big, the incision all the way across the hairline. So
Yeah,
part of it's hidden in the hairline, part of it is on the scalp. But it's remarkable because patients really do recover very, very quickly from brow bone contouring, brow bone reconstruction. But the further down the face, the structures that are operated on, so feminizing rhinoplasty, or for those that are having chin contouring, the area, the surgical area that is, um, it's a much smaller area, but I have to say that those are the two areas that the recovery is the longest, and that's because the soft tissue changes take longer to heal. The swelling just takes longer. And the way that I like to describe that to patients is that because it's towards gravity, it just takes longer. So for patients that are having their chin contoured, you are looking at swelling, overlying soft tissue swelling for up to 3 to 4 months. And as Francesca just mentioned, you know, the recovery, the swelling that you get from brow bone contouring, it really is remarkable how quickly patients heal. We are quite strict with our aftercare, and it is important to say that surgery really is just one part of it. The aftercare is so crucial as well. And you were brilliant. I didn't know that you went out at day 10, but you have absolutely fantastic. Uh, yeah,
Yeah, I
no, I
mean, I
saw you
did keep
did.
that to myself
It,
until now.
it's okay because we want you to get back to having a normal life. We just want you to do that in moderation. You know, we want you to
Yeah,
be sensible. You were very good. You
I
were
was
very
a good
good. And one
girl.
of the really important things, Francesca, that I'd like to highlight as well is that just before surgery, and the whole purpose of the pre-assessment as well, is that, you know, there are simple things that we ask patients, and it's really important for facial surgery that it's adhered to. So smoking, whether it's nicotine or vaping, is something that if you are a smoker, for those that are interested in FFS, we do ask that that is a habit that is stopped at least 4 weeks before surgery. And the reason for that is that we know there's documented evidence, and we know from our own surgical practice that that does increase the risk of infection, and it also increases the risk of wound healing issues. And what you don't want to do is go through a big surgery and then have issues with wound healing. It really is, it complicates the process, and your recovery takes much longer. We also ask that patients don't take medications that increase the risk of bleeding during surgery, or maybe the risk of having a hematoma, which is a bleed after the surgery. And those medications are simple analgesics like ibuprofen, and even certain vitamins, which is why we asked you the question, you know, do you take cod, cod liver oils, fish oils, because they can increase the risk of bleeding as well. A lot of patients, Francesca, ask about laser hair removal and electrolysis. And what we say is that you can
Mhm.
do that just up until the point of surgery, but after the surgery, we ask that you wait about 4 to 6 weeks. The recovery after surgery is very much dependent upon the individual. We really like to encourage our patients to walk, soft diet, to take things in moderation, no contact sports. So that's really important for brow bone reconstruction. It's a very sensitive area. So, you know, we've had skateboarders, we've had all sorts of patients, and, you know, you really can't be looking at going back to contact sports for at least 3 to 4 months afterwards. You really have to wait for good bony healing. And aside from that, having a really good, you know, your support network is everything. And whether that's a group of friends, family, a partner, it's just so important, because supporting you, you're very groggy in the first few hours, the first few days after the general anaesthetic, is just everything. But also, as Francesca mentioned, the psychological support is immense. Another question that we had is, somebody said, what is MLD? Because that's one of the things that we ask our patients to do. So for those of you that don't know, MLD stands for manual lymphatic drainage. And Francesca, do you think that actually helped with your recovery?
100%. It helped so much that I especially like I had a lot of swelling in my nose, and
Yeah,
I could really start to see the like I guess I kind of still do it a little bit in the mornings when I it takes like a year for a nose to heal, right? So I feel like my nose is sometimes a bit swollen, it
yeah,
looks more snatched other days. So I generally like to kind of do the
brilliant.
routine of the MLD, um which the nurse showed me. And yeah, I would definitely say it helped a lot. It got a lot of the swelling and the kind of tenseness out of my face. Also, it was just nice to come into the clinic and have a chat and relax and have a facial
Brilliant.
massage, you know? Like, how can
Absolutely,
that not
absolutely. And
help?
we have really fantastic, dedicated MLD experts that are crucial in supporting patients after surgery as well. And it's really important just to help
Yeah,
improve the lymphatic flow after having surgery, and also to aid in your healing. So they teach you great techniques which you can use at home. Yeah,
still
absolutely.
using
Told
that,
you,
baby. I'm
get
still
gold
doing them.
star
I'm
for
still
being
doing
a fantastic patient.
that.
I had a question. So I was asked, Francesca, what is the most common FFS procedure performed? And I'm not sure if you know this, but I would say that in my clinical practice, surgical practice at the London Transgender Clinic, it would be brow bone reconstruction plus or minus rhinoplasty. Actually,
Yeah.
we do a lot of that on a weekly basis. Not to say we don't do the other stuff, because we do, but there is a lot. And sometimes the requests come in peaks and troughs. So at one stage we were doing a lot of thyroid shaves, thyroid cartilage shaves. I was also asked if there are any alternatives to FFS, and Francesca mentioned that she had had filler. Do you want to talk to just talk to our viewers that are listening about your
Yeah.
experience with fillers, which you didn't have with us at our clinic? But if you just tell them
Yeah.
why, how, where, how easy you found that, and how you compare surgery actually to fillers.
Yeah, absolutely. So when I was first starting my transition, obviously I had a lot of dysphoria and I didn't have the same kind of access I do now that I did to clinics like the London Trans Clinic. Um, and I was collaborating with a doctor on social media, YouTube, and we did basically a collaboration for non-surgical facial feminization surgery as like an alternative. And I would say brow bone area, your eyebrows probably is the most kind of like giveaway almost. Not that it's like it seems like bad to say, but I feel like for me anyway, it was the thing that got me clocked the most. You know, it's very like Neanderthal, just the way it develops. So I would get like quite a lot of filler in my temples and here, just kind of like round it out and Botox to raise my eyebrows. It was kind of like manipulating the eye almost, you know, and then just general overall softening to the rest of my face. Because I kind of feel like estrogen gives you that, but I was impatient, so I just like to plump my cheeks up, my lips. But to be honest, I would say even though it appeared like, you know, all gorgeous, and it was like I was like very happy with the way I looked. However, it was kind of I needed something where I could like wake up in the morning and actually still feel as good as I did when I finally like got glam, you know? And that's when I always knew that I needed to have this surgery. Um, but yeah, I wouldn't say they necessarily compare, but I would say it's kind of like case by case, isn't it? Like not everyone's the same. So I feel like for me anyway, it was like crucial that I had my brow bone shaved and my hairline lowered because uh yeah, I mean
Yeah,
there's only so much
yeah,
filler is gonna hide, I guess. Like I still had a shadow in the sun, which I think caused me the most
yeah.
dysphoria because I just felt like I had like a ledge. And now I just like feel like I can
Amazing.
open my
Yeah,
eyes,
and I think you're
you
right,
know?
Francesca. Somebody's actually asked a question. I think it ties in quite nicely. Let me have a look at that. One of the questions that came up was, can you disguise the brow bone with filler? So, injectables in the cosmetic world, in the world of aesthetics, involves either botulinum toxin, which is brand name. Botox is a brand name of that, for some of you that may know it as that. And dermal filler. So dermal filler is a gel-like substance that is temporary, but it's injected in and around the facial skeleton, to add volume. So the question was, can it disguise the brow bone? To a certain degree it can, but because you're adding volume, it makes it look bigger. So if you have a bump in the forehead, you can disguise that with filler, but it's going to make your brow bone look bigger. I do both. I am a surgeon by nature. That's my background. I'm fully surgically trained. I'm a surgeon and GMC registered on the specialist list of oral and maxillofacial surgery. But I also have a huge passion in non-surgical aesthetics. I'm an honorary senior lecturer at the University of Manchester, so I teach other aesthetic practitioners how to give it safely. So I definitely think there's a place and there's a role for sure for injectables in the clinic, actually, we like to use botulinum toxin square jaw. So lower down in the face, we have a lot of patients that come to see us that don't like the width actually of their jaw. And botulinum toxin injected into the masseter muscles is an amazingly powerful way of reducing the width of the lower face. Francesca mentioned that she had some botulinum toxin to give her a bit of a brow lift, and what patients will find is that those that have got really heavy brow bone, really heavy frown gain, will be invited to the clinic before their surgery to have some botulinum toxin in around the brow muscles to prevent them pulling down, because what we want to try and do, Francesca, as it was in your case as well, is give you this real opening, this real lift, which is what surgery allows. But if you have brow bone contouring, brow bone, if you have a prominent brow bone, sorry, was what I was meant to say, then undoubtedly brow bone contouring is ultimately the thing that you will need. And it's a beautiful, it's a beautiful procedure. There are, yeah, and
Literally
absolutely
life
life
changing.
changing for our patients that have the surgery. And talk to us about your healing, because that was another thing that somebody said. I mean, surgery
Yeah.
does involve scars, but our job as surgeons is to minimize that scar, so to optimize the scar healing,
Yeah.
which is why the post-operative care is so important.
I mean, I could actually show my scar if you like. It's pretty much like I don't actually really have a scar anymore, and it's like three
Remarkable.
months post-op. This is my
Remarkable.
healing so
Look at those
far,
baby
and these are
hairs
the
that are
baby hairs
growing
that are
back.
growing over.
And there we go. There we go.
It's
Not
like
filtered, completely
insane.
authentic. Yeah, thank you for sharing
Not
that with
filtered
us.
at
Thank you.
all.
Because it's a
No,
very, very personal
absolutely.
thing. And so for those that are listening to this, it's really important that they hear from you. You know, I talk to them as the facial plastic surgeon,
Yeah.
but they want to hear from others that have been through that journey. And that's really, really important. Would you do it all over again? Would you choose healthy? Would you choose Berridge and
100%.
Mr. Fantastic.
100% pick you guys again.
Oh,
Maybe I'd have you
fantastic.
all again. Come on.
You
I'm
don't need
coming
a
back for
part
part
two.
two. I don't.
Oh,
I just wanna
wonderful,
vibe.
wonderful. Francesca, any words of advice for those
Yeah, I
that
had
are
the best
potentially considering
experience.
FFS and coming on their journey with us at LTC?
I would say be realistic with expectations and also be like have an open mind with what the surgeon is telling you. Like, I mean, I wanted my chin done, I wanted my jaw, and you were like, no, 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 no. And I was obviously initially kind of upset about that because I had this idea in my head of what I needed to do to be, I don't know, a woman. And I think I, yeah, I really needed to come somewhere like here and I don't know, have the experience with surgery that I did because I think I could have really got carried away. So I think be open-minded and listen to your surgeon. Come to the London Transgender Clinic because they're not going to push you to do too much. Like honestly, I feel like what you guys kind of the package that I had with you guys, I feel like was perfect for me, you know. I don't think it could have
Oh, thanks.
gone any better. Um,
Oh,
and I would 100% do it all
that's
again.
honestly a really good testament, and thank you very much for sharing your love and your support for the work that we do. Shall we try
No,
and see if
absolutely.
we can answer just a couple? I think there are a few more questions to it. Is this a younger person thing? I'm a mid-60s trans woman and wondering if it's worth it or if it's too late. Francesca, do you want to answer that? Yeah.
Absolutely not too late. I mean, yeah, absolutely not. There's nothing else I can really say to that, but I mean, like, just because you're an older person doesn't mean you don't like deserve to be happy or feel beautiful, you know? I feel like I say this to my mum all the time. I'm like, girl, like, I don't know, like,
Yeah.
get your hair done, do what you want, like, let yourself feel gorgeous. Just because you're an older person doesn't
And
mean you don't deserve that, you
I'd
know?
like to reiterate that as well, is that there is no age limit. You know, we are treating patients to improve your comfort and to improve your confidence. And so it might be at the age of 60 for one person, and it may be at the age of 21, 22 for another person. It's so, so individual. And yet again, that's what I'd like to reiterate, is that there's no set protocol. There's no set pathway. Facial feminization surgery doesn't need to be for everyone, and sometimes it's not. So your transition journey is very bespoke. It's very individual to you, and that's the most crucial thing. That's what we need to know at that first consultation. Francesca, I realise that you have to go, so I do thank you.
I'm all good.
I have to say we thank you here at the clinic. One, being a fabulous patient.
No,
Two,
absolutely.
for I think coming on here and sharing your story. Yet again, totally inspiring.
Yeah.
It's really, really good for patients that want to come to our clinic, and actually for patients that are existing at the clinic, to hear real stories and to hear from real patients. So we can't thank you enough. Yeah,
Well, same
and it's
time next
amazing.
week.
It's amazing. I mean, you've got the most amazing personality, but it's so wonderful to hear you say just how your confidence has skyrocketed, and that's
Yeah. I feel like a
brilliant, brilliant.
different person. And it's only been 3 months, and I just feel like I'm like
Well,
just
that's
like
what this is all
living my
about.
best
This is
life,
about us supporting you
you
living
know?
your best life. So until we see you in the clinic again at the next post-operative visit, I bid you farewell and thank you so, so
Yeah.
much for coming on tonight. Take care.
Take care, gorgeous.
Lots of love.
Love you lots.
Bye-bye.
Bye. Thank you,
Bye-bye.
guys. Bye.